Hello, my name is Jamie. I'm an emergency department nurse and as of this month, an ANCC certified adult gerontology clinical nurse specialist. Finding guidance and study material for this exam was very limited, so I'm here to tell you tips and tricks on how you can pass the ANCC certification. First of all, please don't be like me. I highly recommend you take your boards as soon as you can while the information is still fresh. If you decide to take the summer off to celebrate your degree, I promise you that you will be so disappointed on how much information you have not retained since graduation. Secondly, don't forget the CNS has 3 spheres of clinical practice: direct care, nursing practice, and systems and organization. I focused so heavily on the direct care portion when it came to my studying that I ended up failing my first attempt at the certification exam. Make sure you also focus your studies on maximizing health for the older adult, advocating for patients and nurses, system leadership, quality improvement and safety, evidence-based practice and research. Just like taking the NCLEX, don't stress about pharmacology. I can use one hand for how many pharmacology questions I had on both tests. Specific areas of focus I found most important in this test was problem solving. What are signs of elderly abuse and what are you going to do when your patient presents with clues of this? Or what about polypharmacy, herbal supplements, substance abuse? Or what about approaches to negotiations with staff members? Or even what about if a family disagrees with the care plan of the patient? Be prepared for the longest test of your life. You have 3.5 hours to answer 175 questions. I used the full 3.5 hours both times I took the test. And that's okay. Use the moments you need to sit back in your chair, take 10 deep breaths, try not to cry, and get back at it. The test allows you to highlight, and I really recommend highlighting keywords in the question. Now on to study material. Definitely not much out there. The books I used were the Adult Gerontology Clinical Nurse Specialist Certification Review from Springer Publishing and the MoMetrics Adult Gerontology Exam Secrets and Study Guide. Both focused on all CNS spheres of influence. The Springer Publishing book was heavily focused on the patient-centered care, or in other words, like health assessment and pathophysiology portion of the exam. And I didn't want to have to buy additional nurse practitioner study materials, so that was nice. And then the MoMetrics was a great review, but I do feel like the practice questions were easy and not as difficult compared to the actual exam. Online, I also used ExamEdge. It was a website that provided 25 practice tests, each including 100 test questions specific in preparing you for the certification exam. I found this super helpful. If you do decide to purchase this, don't feel overwhelmed if you fail every practice test. I felt like the questions were harder than the certification board, and to be honest, I never got higher than a 65% on any of the practice tests. I did build an in-depth study guide to help break down the content and really focus on what I needed to pass my exam. If you're like me, reading a 400-page textbook just isn't time proficient for studying. If you're interested, my study guide is on Etsy for purchase, and it's called the Adult Gerontology Clinical Nurse Specialist Certification Review. So that's it for my tips and tricks for passing the ANCC Clinical Nurse Specialist Board exam. I wish you all the best of luck.